So, if you don't mind, can I ask you a few questions just to start off?
Well, you don't waste time, do you? Nah, I don't mind at all. Ask away.
Perfect. So, could you just please tell me your story, that is about your life as a person and possibly even how you've gotten osteosarcoma?
I've been asked this a lot. So, prior to my diagnosis, I was a psychology student at LSU, Louisiana State University. I considered myself to be a very fit guy, healthy. I like to play volleyball, tennis, soccer. I was even considering playing it as a sport, like a profession, not just to get the girls. But a few months ago, my dream was shattered. While I was playing a tennis match, I broke my arm. You may be thinking it's because I fell or something. No, I hadn't even hit the ball. My mom took me to the emergency clinic and the doctor ordered an x-ray. It seemed that I had broken my arm at the humerus. Instead of putting a cast on it, he sent me to the hospital. I remember my mother questioning the doctor about why I wasn't going to the hospital, why I didn't put a cast on, when it was just a broken bone. But the doctor explained to her. The further investigation was needed to explain why the bone broke. When I just lifted my arm, I was confused, what? So the ambulance took me to the main hospital, and the trauma doctor checked me in and ran blood tests. He looked at an x-ray and both were negative, so he would refer me to, these doctors have really funny names, Dr. French and Dr. Flint. They were bone tumor specialists. I asked him why he was referring me, and he said there must be something in the bone that was serious and needed further investigation. So I was admitted to the hospital, and on the following day, Dr. French and a cancer nurse visited me. Lots and lots of testing and stuff happened, but essentially I was diagnosed with osteosarcoma, and now here I am. There's a lot of gritty, schmitty, ditty details, but I think I've answered the first question long enough.
Wow, that must have been quite the experience. Thanks for sharing your story. It seems like your parents are finally here, and let's head over to home now.
Okay. So as you can see, the doctors made this room super comfortable for me while I wait for my chemotherapy session. So we can talk a little bit, and then when I get work done, you can talk to my doctor.
If you say it's okay, that is.
It's okay. Hit me with your best shot.
Okay, so I know there are different types of treatment, like chemotherapy, radiation in some cases, and surgery. Do you think you can tell me what you do, how your treatments affect you, and maybe how many times you receive it?
Oh, well, it really depends on the person. But I do chemotherapy, and I do that in cycles. Now I'm on, the third cycle. My first cycle of chemo treatment, which I got cisplatin and, doxorubicin. It was a whole day of treatment for 5 days. I was bored on my first day of treatment. All I did was, lie in bed and go to the restroom. Yeah, it was kind of gross. I was watching the clock ticking and could have waited until 5 p.m. because I was allowed to go home. I went home and I was happy that I did not feel sick. Then I was like, I think 9 p.m. because I just finished watching my favorite TV show, Once Upon a Time. Anyway, it was 9. I was sick as a dog. We have a 24-hour helpline, so my mother rang them seeking assistance. The nurse told her to take me back to the hospital. I was admitted in the hospital for the rest of my first treatment in order to control the side effects of the chemo. It was terrible, but as my cycles continued, the side effects were less severe, so it was a little better. Well, maybe before I was diagnosed with osteosarcoma, there were some signs I should have known, some swelling and pain in areas that shouldn't have been. But I kind of just passed it off as, my sports and stuff, because, they were really active,
Yeah, well, do you think that if you did something back then, it would have greatly affected how you are now?
Well, maybe it would have, but, you never really know now. And it doesn't really make sense worrying about it now. And you can't really screen for osteosarcoma, so, yeah, oh well. But yeah, I have to head to my session now, so catch you later.
You must be the doctor. My name is Kaylin. It's nice
Hi,
to meet you.
Kaylin. My name is Molly. So Jose told me that you had some questions about this.
Yeah, I was wondering if you can give me some historical background on osteosarcoma, and also if you'd like to add anything else.
Yeah, there's a lot of information about it, so it can get overwhelming, but I can definitely give you some information about it. But let's first sit down. Basically, osteosarcoma is an ancient disease that is still not completely understood. The term sarcoma was introduced by the English surgeon John Abernathy in 1804 and was derived from the Greek root meaning fleshy excretions.
Oh, really?
Yeah, and so basically a year later, the French surgeon Alex Boyer, who in case you didn't know, was a personal surgeon for Napoleon, first used the term osteosarcoma. Boyer realized that osteosarcoma is a distinct entity from other bone areas, basically, such as osteochondromas.
Whoa, so this happened way back then?
Yeah, so basically, osteosarcoma is the most common type of cancer that develops in the bone. Like the osteoblast in normal bone, the cell that forms this cancer make bone matrix. But the bone matrix of the osteosarcoma is not as strong of that of normal bone, so your bones are very weak. This usually affects children and young adults, so teens are usually the most affected age group. But honestly, it can happen at any age.
Oh gosh.
So I'm probably confusing you with all this information and like overwhelming you, but it's seriously, don't get overwhelmed by this.
It's okay. So what types of support networks or foundations do they have for patients with osteosarcoma?
This disease is not the most common cancer overall, but there are foundations that fund different aspects of this disease. There are St. Baldrick's Foundation and Cure Childhood Cancer. There's also smaller funds such as Danny's Foundation and Nick Reamer's Osteosarcoma Foundation, Inc.
I've heard of some of those.
Yeah, so I'm gonna go back and talk to Jose. This might take a while, so I would get comfortable, read a magazine. So it was really nice meeting you, Kaylin.
Thanks, Molly. It was really nice talking to you.